Hi guys, welcome back. In this video, we are touching the practice aspects of dentistry in India and abroad. As spoken about entrepreneurship in the last video, it applies to the practice in dentistry in India. If you start a practice, you know how to set it up. We have different sessions coming up exclusively for practice setting event, management, and promotions, and expansion, franchising, such things, So you keep watching. I have myself started more than 20 clinics. I successfully run, transferred, sold, and few of them still running, and I stopped few clinics, and I have learned everything in and out, how to create a chain by myself. And I think I can talk about it very authoritatively. So keep watching my videos regarding practice in dentistry. Now I am touching how to practice, how to get your practice dream abroad. I happened to be in the UK for a while, and many of my juniors have been flying to the UK, settling there. This is the right time for a while. That they have a tendency to open it up and demand and supply. When the demand is over, they'll just close it, and they make you write the exam, and the pass percentage will be very low. Now I think it is open right now, right? And many of our Indian dentists are flying to UK. There are many pathways offered right now. Also, university program is happening. So people are going to become a therapist there. Then people are going to study other courses and be there and prepare for ORE examination. So that is the way of RE, overseas registration exam. That is what is happening in the UK. You have opportunities in Ireland as well. Licensing examination equivalence examinations are mandatory for Australia, New Zealand. In the US, as you know, you need to write NBTE part 1, then try some exam, some advanced courses, 2 years, or then MBT 2, DDS. Sometimes varies, depends on many states. So if you really wish to go to US, get ready to study more in dental school. Canada, 2-year advancement program. It is, I think, straightforward there. ASEAN countries, Singapore, Brunei, they have licensing exam for Indians. We have MOH in Saudi. I've heard STLE something, Saudi licensing exam. MOH in many parts of UAE, DHA in Dubai, HARD in Abu Dhabi. It's quite Americanized exam, a bit tough. OSCEs are in place, object structured clinical scenarios and exams, But Abu Dhabi is a hotspot these days. Next comes Kuwait, KDLE, Oman, Qatar. These countries are still open for Indian dentist practice. There are other countries, African countries, they need dentists badly, and you need to look for it. You can go as a voluntary dentist there, then be a part of it. From there, many travels to other countries as well. Given you a rough idea about the exams, all these countries has got their own style of conducting these exams. Many of the countries allows you to take exam from India, the first part, the second part you have to go there. So make sure that you get the temporary licensing. You can have both, go for studies and get into the system, or you go for the studies and continue your studies in the schools and become an academician there rather than coming to practice in dental schools. The philosophy behind the exams are they don't want their patients to be experimented by the dentists from other countries. They want to keep their patients, their public safe from unqualified people from other countries. So if our qualification is equivalent, they're just testing your equivalency and getting your full license. So get ready if you are passionate about setting up a practice in the other countries, or if you want to set it up, if you want to live in other country, Europe or US or Canada, or even Scandinavian country. Forgot to tell you, the Scandinavian countries, people go for studies. They learn the language. They do some research. They start a practice. I know 2-3 of my seniors have been in those countries, Finland. So the most happiest country, So all these opportunities are there, and mind you, learn the language or any foreign language in those areas, those countries, those Baltic or Scandinavian. You have an edge to get through the exam because they need professionals badly. But I am not a person who will advise you to fly away from India, because India would need more dentists and India would need you. But your passion, your time, your enjoyment, for the time being, it's good to be there to see the world and experience kind of dentistry which we dream to have it in India. Thank you very much. See you in another video.